A very good evening to all the viewers. Welcome to the IJCP chat show on Ivy leaf extract for productive cough, what latest evidence says. I am Dr. Shweta Ghadge from the medical team of USP. Cough is the most common pediatric problem managed by doctors. There are multiple causes of cough, and the extended duration of coughing causes distress to both children and their parents. Management of cough is difficult since effectiveness of traditional medications to either cure or relieve symptoms of cough in children is a challenge. To discuss more on the latest evidences in the current management of productive cough and use of dried ivy leaf extract cough syrup, I welcome Dr. Vijay Varat sir, consultant pediatrician, allergist, pediatric pulmonologist, founder, faculty member of Allergy Chapter, faculty, master trainer in asthma and hope module. He's conducted more than 43 national and international trials as principal investigator and has delivered lectures across India for chest physicians, ENT, dermatologists, physicians on allergy management. Thank you, sir, for joining us today. And here, sir, we would like to understand from you that what specifically is about the ivy leaf extract and how effective it is in management or treatment of productive cough.
Basically, ivy leaf extracts are the Hedera helix. So basically, it's a extract from the uh, ivy leaves, and which is used as a cough syrup.
Right. And sir, how effective is it in treatment of productive cough and considering it to be a very distressing situation for both parents and the children? So, how does it help in treatment of productive cough?
See, basically, productive cough means what? Whenever, because of whatever the cause may be there, when there is a cough into the throat or to the lower airways, and the patient coughs it out, and the sputum or phlegm comes, then it is called a productive cough. So there are different causes of productive cough. So most of the commonly is a acute viral infection also. But now considering the change in scenario of diseases, now we are seeing a lot of inflammatory coughs also. So in the inflammatory coughs, if you see the specifically in children's, number one chronic disease is the allergic cough. So it may be because of the rhinosinusitis, which is leading to the postnasal dribbling, or it can be the allergic bronchitis, asthmatic, and even many of the viral or bacterial bronchitis also, which cause a productive cough. So while treating these patients, the aim is that the patient should be able to expectorate easily, and so that he should relieve of that whatever the flame is there, the mucus which is sticky or which is causing a discomfort to the patient. So these leaf extracts have been utilized for that purpose. There are different medications already used into the market, but specifically the leaf extract has been used for the purpose like it should have a good efficacy as well as the tolerability and the safety profile to the patients, which will be taking for the relief of the cough.
Right. So, sir, here, like you mentioned, that coughing causes a lot of discomfort to the children, and sir, cough becomes a very symptomatic. It is one of the major symptoms of acute bronchitis, and there are other symptoms associated with it as well. So, in acute bronchitis, how does dried ivy leaf extract cough syrup help in alleviating the symptoms?
See, whatever the uh, content of these dried leaf extracts are there, so we'll not go into the details of all those, but there are different studies done, and they have shown that it has a very good whatever the secretions are there, they are getting lysis, so they get loosened, and as well as it has a bronchomucolytic action. So the mucus also gets relieved from there, and whatever the bronchospasm is there, the inflammation, it reduces the inflammation as well as it relieves the mucus. So it's a broncholytic. So the spasm is relieved. So all these three actions they help in these acute bronchitis cases.
Right. Sir, correctly and very important for the audience to understand here that dried ivy leaf extract cough syrup has multiple mechanisms through which it works and helps in alleviating the symptoms of acute bronchitis. Cough being one of the major symptoms, which is completely alleviated by dried ivy leaf extract cough syrup. Like sir mentioned about the bronchospasmolytic and mucolytic actions of dried ivy leaf extract cough syrup. So, sir, in children, there is also issues with expectoration. So, how does dried ivy leaf extract cough syrup can it help in expectoration in very young children?
See, basically, even in the children or adults, why the difficulty is there because of the infection itself, and again, in as I mentioned, the inflammatory diseases have increased like allergy and the indoor and outdoor pollutants. They are adding on the inflammation, and again, some of the inflammatory viruses, like specifically recently COVID or flu viruses and all, they cause a lot of inflammation, and they even they damage the cilia and all. So that's why the patient is unable to expectorate whatever it should be. Thus, there are some studies done which dried leaf is good and as an anti-inflammatory also, and to improve the mucus clearance. So that way, these studies have shown a very good results in even in children also.
Hmm. Right. So, yes, and very again important for the audience to know that expectoration is one of the key where there is a problem that children face with, and dried ivy leaf extract help in expectoration also. Here, sir, we would also like to understand, like I mentioned in the beginning, that it is a distressing condition for the parents also, since the child is suffering through coughing, and there's a lot of pain and discomfort that they go through. So, sir, how quickly is relief seen in children and by their parents after the use of dried ivy leaf extract cough syrup for productive cough?
So basically, in children's, there is a lot of problems while giving any of the cough syrups and all. Even recently, you must have seen in Nambia or somewhere in Africa, even many children they died with the poisoning effects of the sedative
Right.
effects, and already the children are suffering with the sedation because
Hmm.
of the first generation antihistaminics as an anti-allergic or as a antihistaminics. And second, again, the cough syrups are given. And if some of the cough syrups, which are commonly used, have again the sedative effects, so
Hmm.
the respiratory compromise happens. Already the child is already struggling to have problems, and so there are many things like and the irritability, the dryness of the mouth, and so many. Considering these things, the we always look for a safe alternative because
Right.
even I remember my teacher like Dr. P.M. Udani and Swati Bhave madam and all. So they used to say like cough syrup should be selective, specific, and which should have a very good results to the patient, but without side effects. Because till we don't treat the cause of the cough is going to be lasting for then those days. Like suppose acute viral infection, there viral infection goes within 5 to 7 days. If it's a chronic condition like allergic cough or chronic bronchitis, it is going to last for a longer days till we don't manage the disease also. So it's there rather than just giving a side effect medications and just suppressing the cough, we should have alternatives like safe medications, which should have a good actions whatever we discussed now till now, and as well as the safety profile should be there for a longer period. So that's why such type of safe leaf extracts and the natural sources are really helpful to the patient along with the cause of the disease also we have to treat as an. So these syrups are as used as an adjuvant basically. It's that way. Yes.
Right. And sir, here you mentioned about, a lot of cough medications now are getting banned, especially the codeine-based cough syrups and the other cough syrups where sedation is one of the biggest side effects. And here, and you mentioned about, the importance of the drug having a good safety profile. So, dried ivy leaf extract cough syrups are in those, parameters millimeters. How is the safety profile, especially in very young children? Is it as compared to the conventional preparations available? Is the safety profile better in children and very young children?
Yes, man. Whatever, like, I have seen the data still now, and practically I am treating with this preparation since many years. Even I will say more than 15 years. I am using these preparations as a syrups and all. So, and whatever the other molecules also have been studied. And even few years back, I presented a paper in North America regarding the things like whatever the cough syrups which are available with the first generation antihistaminics and sedative properties, they have a lot of side effects to the children for a longer period. And in Indian scenario, even a lot of parents they just have a self medication repeatedly, and it has a sleep cycle effects as well as it alters the cognitive and behavioral disturbances for the longer period. So rather than that, these leaf extracts I have used in many patients and I've found not much, I mean, no side effects, absolutely. So, whatever the simple one, like any of the preparations can have some patients, some intolerance or some gastritis or something. Most of the children, some children may not like, I mean, very few children may not like the test. But besides that, these systemic side effects are never I found. And the studies also shown, like whatever the studies have been done, I have gone through that and I have found very good results are there. No side effects in children also.
Hmm. Right. Right. So,
Yes.
sir, with conventional, like you rightly mentioned, sir, with the conventional preparations, there is issue of side effects such as there can be sedative effects or there can be, taste being a major factor. And all of this is, not really seen or has not been documented with dried ivy leaf extract cough syrup, which makes it a better choice for children and very young children, especially because it's a very troublesome period for them. So, sir, also, conventionally available are ambroxol and acetylcysteine being very commonly used for bronchitis and for productive cough. So, in terms of, if we want to compare the effectiveness, is dried ivy leaf extract cough syrup superior to, ambroxol and acetylcysteine?
See, basically, even the N-acetylcysteine, it is not so well studied in children's below 12 years, actually.
Hmm.
There are no much studies actually properly. And outside also, it is not so used in below children's below 12 years. Ambroxol, it is used. Only thing is that as the tolerability and the compliance by the parents and all. So we have seen the compliance is much better with the natural extracts, and the side effects are less compared to that. And efficacy wise also, this is a very good. Like already I am using since many years, and whatever the research also has shown a very good efficacy over the ambroxol and N-acetylcysteine also. Comparing the efficacy and the side effects, and if we want to give for a longer period or repeated use also, it has a good efficacy.
Hmm. Right. So, as compared to conventional preparations available in the market and studies being available when compared to ambroxol and acetylcysteine preparations, dried ivy leaf extract cough syrup does have a superior safety profile and also is effective in treating acute bronchitis. Sir, since we spoke about acute bronchitis and productive cough, another, one of the common respiratory tract infections is also, chronic bronchitis. So, is it effective in children for chronic bronchitis, dried ivy leaf extract cough syrup?
Yes, already, I mean, there are studies done, and it has a very good bronchospasmolytic action. So the inflammation and the muscle spasm relief with this leaf extract has been proven, and it has been used for a longer period also the children, and they have shown a very good efficacy if it is given for a weeks together also. So I mean, and already I am also using in my practice, and I have found a very good results. And it can be used for even chronic bronchitis, asthmatic patients, even post-nasal dribbling, which is a very common problem nowadays because of the, as I said already, the inflammatory viruses and the indoor and outdoor Pune, Mumbai or metropolitan cities. We have found that. So this postnasal inflammation and rhinosinusitis causing a again repeated laryngobronchitis. So these extracts have been very useful.
Mhm. Right, right. Here, sir, since you mentioned about asthma also, so as an adjuvant to budesonide, can it be considered to be used as an adjuvant therapy for asthmatic children?
See, generally, in even bronchitis and asthma, always it is a chronic condition. So, inhale corticosteroids are the best one to control the inflammation. But some of the patient, if they have a specifically postnasal dribbling and the cough which is not getting much relief, rather than adding on with the traditional salbutamol and all, which we may have a tremors and palpitations and other things. So these extracts also can be given and they are used. And there are studies also done. They have very good efficacy also.
Mhm. Right. And sir, the conventional preparations, they do have issues with use in a longer duration. If it is used for a prolonged period of time, they have their own side effects that they can cause problems to the children. So, sir, is there any duration and dosage that needs to be considered specifically for dried ivy leaf extract cough syrup, especially in very young children?
See, at such, there are no issues. As I said, already the research also shown like it can be given for a longer period, as well as in my practice also I am using. And even practically, these chronic bronchitis and asthma patients, actually, whenever the symptom wise it is required, it's not that they have to be given for 3 to 6 months because the chronic inflammation basically it's a nasobronchial reflex. So the nasal hygiene and the nasal management and the inhaled corticosteroids are the mainstay of treatment, along with Monturic acid or anti-inflammatory to stabilize the mast cells. But whenever the symptoms are there and whenever it is required, it can be given such type of preparations like a dried leaf extracts for a longer period also. No problem.
Hmm. Right. So, sir, again, this has been a very wonderful discussion where, we understand that there's a lot of apprehension with use of the conventional medications that are available for productive cough. And with this, the availability of dried ivy leaf extract cough syrup with multiple mechanisms and providing the safety benefits and efficacy in multiple indications of upper respiratory tract infections. It provides a very good result, especially in children and very young children. So, the information that you shared today has been very valuable and highly informative for us. Sir, we would also like to understand since you mentioned that you've been using it you've been using it frequently in your clinical practice. So, any experience that you would like to share with us for use of dried ivy leaf extract cough syrup?
Yes, actually, as I mentioned, any of the preparations when you want to give it to the patients, there are three things has to be done. One is that the efficacy is most important. Second is that the side effect should not be there, and third is the tolerability. And so this molecule specifically is used very well safely, and even like 2 to 5 years, 1 teaspoon 3 times a day can be given. 5 to 12 years, around 2 teaspoon 3 times, and even adolescents and adults 3 teaspoon 3 times a day. And I have seen like even given for a longer period also. Suppose somebody requires a 1 week or 2 weeks also. The tolerability is very good with the patients, and uh, I mean very few parents has complained about that. Otherwise, when we give other most of the cough syrups, they are very bitter, and the children they start to vomit, specifically young infants and toddlers and all. But with these leaf extracts, we never found such type of complaints. I mean, and most important is that the systemic side effects, like other molecules, like whatever the salbutamol, terbutaline, and all, the palpitations, tremors, and even some of the children they complain gastritis and they vomit it out. So such type of things we haven't found, and the efficacy is also very good. I mean, whatever the research is done, whenever the research is done, it is always with the randomized control trials. So there are also randomized control trials with this extracts and which have been shown a very good efficacy. So in my practice also I have seen many patients have shown a very good results, and uh, very better efficacy as well as no side effects. So that's the basic our aim while using the molecule, and that's why I think it's a very good molecule. So even not only the acute bronchitis, chronic bronchitis, even as I said, the rhinosinusitis and the postnasal dribbling is a major problem now because of the inflammatory conditions and the inflammation, which is increasing more now.
Hmm.
Even there are studies done. Whatever the children's with tonsillitis, throat infections, and adenoiditis and all, they have a primary taste to inflammation, and which have a secondary infections. So the primary taste to inflammation is now because of the allergy and allergens. So those conditions have increased, and where such they have a repeated episodes, maybe
Hmm.
because of the school environment, the molds, funguses, and the pollen allergy has increased. And in the indoor also, there are many factors which trigger that. The smokes and not having a good ventilation, dust mites into the bed, and all. There are thousands. So they have a repeated episodes of this, and those patients, the safe medication is very important. And I have found
Hmm.
like this extract have been very well useful in acute conditions also. Thank you. Thanks a lot.
Right. Again, sir, wonderful having this interaction with you, and thank you, sir, for sharing this, vital information. Which today, when there are so many issues going on with the cough syrups that we are listening to every day, and there is a lot of apprehension among doctors and among parents to prescribe the commercially available medications for productive cough. And with this, the availability of dried ivy leaf extract cough syrup, due to its highly efficacious and safety profile, provides the relief, maybe that that can be considered to be used in multiple indications, and without any worry, especially in children and very young children. So thank you so much, sir, for taking the time out and for having this discussion with us, and for giving such wonderful insights to the audience. So thank you, sir, for your time.